pretty exciting things in store for you during the next 4 days. But I wanted to review, because I think there are a lot of people joining us that are probably new to Dysautonomia International. You maybe don't know who we are as an organization, what we do, and how you can get involved. Because that's one of the most important things we're trying to emphasize during this conference, is that even though we can't get together in person this year, there are a lot of things we can do to keep building our community, making us a stronger community, doing more advocacy, pushing for more research, educating doctors so that patients can get better care, and educating people in our communities so that we can get the support and resources and compassion that dysautonomia patients need. So a little bit about what we do. We first and foremost are focused on advancing the pace of research on autonomic nervous system disorders. There are very, very few people in this field that seriously study and try to understand autonomic disorders. And so we're trying to grow that field and support the people that are in that field and actually get them to talk to each other. Surprisingly, when we first started doing this, there were a lot of researchers in little pockets around the world who were interested in autonomic disorders, but maybe not trading notes as much as they should be. So we have more of that happening now. Clinician education, obviously, even if we found the cure tomorrow for every type of dysautonomia, if we hadn't educated doctors on how to diagnose autonomic disorders or how to implement standard basic treatment, even if we had a cure, people wouldn't get access to it if they couldn't get diagnosed or couldn't find a doctor willing to treat them. So we have a big piece of work to do on that. Not only doctors, but nurse practitioners, physician assistants, physical therapists, nurses, respiratory therapists. Pretty much everyone in the field of medicine needs to learn at least the basics of autonomic disorders, and we need to grow more specialists in this field. Then we obviously do a lot of public awareness. This is Dysautonomia Awareness Month, which is something we launched as an organization. On our very first day that we kicked off DI, we launched Dysautonomia Awareness Month in October 2012. Patient empowerment and advocacy. And I actually have a little bit more detail in the future slides, so I'm going to skip. Oops, sorry about that. So what does it mean to support research? It's not just donors give to us and we give money to researchers. It's actually much more than that. So that is one of the primary things we do is that we ask patients and caregivers and businesses and anyone interested in autonomic disorders to donate to Dysautonomia International so that we can fund research grants. Research grants are very expensive. Our largest grants to date have been $200,000 grants going out to multiple researchers in 1 year. And that's really just a tiny fraction of funding that is needed to better understand autonomic disorders. So what we're funding at this stage in our growth as an organization is seed grants that kind of let a researcher explore a topic, do the first study in a topic. And if they find something interesting or meaningful, then they can take that data and they can go to the National Institutes of Health or other larger government funding agencies that can give them $3 or $4 million grants every year. We're not up to that yet. We're hoping we get there. There are other patient advocacy organizations like the MS Society gives out over $20 million a year in MS research grants, but they've been around for 50 years. So they've kind of got an edge on us, and we're going to grow into that type of organization. That is our plan. We also do our own research. Sometimes there are things that need to be studied because there's so few people in this field. That they're just so busy. They don't have time to do all the research that's needed to be done. So sometimes we've led our own studies, working with the experts on our medical advisory board and other experts, bringing in people. And the studies that we run most often are at our own conference, or sometimes we collaborate with researchers during a conference study. So we usually have this conference every summer in person, and we do a study at the conference. But this year, we're just doing online research because the conference is not in person. We also advocate for research to happen. Sometimes you have to sort of motivate researchers because there isn't a lot of money in the funding for autonomic disorders. A lot of people who study this also study other things because they have to pay the bills basically and pay their staff and pay for their research lab space. So to kind of get people into dysautonomia research, one of the ways we grow the field is by making more funding available for these researchers, because it's very hard to have a career in research if you just dabble in dysautonomia research. You really kind of need to throw yourself into your field and know that there's going to be funding in the future. We've also done some registry building. We built, we call it the Big POTS Survey, which is probably about 9,000 patients to date. It's an international survey. And we asked patients, would you like to be contacted about future research? And most patients said yes. So that serves as a registry that we will continue to build. It's a collaboration between Dysautonomia International, University of Calgary, and Vanderbilt University. We help a lot of other researchers recruit for their studies. And if you happen to be a clinician or researcher listening to this, if you have any type of autonomic disorders research that is IRB approved, meaning it has an ethics approval from a university, or a foreign equivalent of IRB in Europe and other countries, there are, IRB is what we call it in the US, but there's something similar to the IRB in every country. And so we help researchers with university approved studies recruit for any autonomic disorder. We assist researchers with study design. In fact, several times we've kind of suggested study ideas and researchers kind of went and ran with it and turned it into a formal study. We also have our patient advisory board members help out with reviewing study protocols. So they'll kind of sometimes go through like a practice run of a survey and kind of give feedback to the researchers. And we sometimes ask other patients and caregivers to help with this too. We're trying to, right now, this year, our focus has been supporting young investigators because there are not a lot of young people, young researchers, clinicians in the field. And when sort of the old guard retires, we're going to be in big trouble. So we really need to recruit young people into this field. And part of doing that is assuring them that there is going to be funding available and helping them get clinics set up. What I'm most excited about is that we're seeing a lot of young people who have dysautonomia, who've kind of gone through the worst of being like really sick with it and managed to get well enough to go to medical school, to go to nursing school, to get a PhD. So I think we're going to have a new generation of researchers that really understand this because they have it. So that's kind of a neat progress. And then also there are a lot of experienced researchers in the field, and we're trying to kind of get them to focus more on dysautonomia. You know, there are all different types of dysautonomia, and it's there's more funding in like diabetic autonomic neuropathy or Parkinson's associated dysautonomias. And the patient population we serve, we do include all autonomic disorders for our educational and patient support, but most of the people that are contacting Dysautonomia International needing help and support are younger patients with POTS and orthostatic intolerance and neurocardiogenic syncope. And these patients are, there's not as much research going on in the younger dysautonomia patients because there hasn't been as much funding put into that, but we're trying to increase that funding. So speaking of which, we launched the POTS Research Fund in 2013, and you can see on the right side, the funding, the amount of grants we've been able to give out from that has grown every year. And last year, we were very happy to give out over $800,000 in grants. It seems like a lot, but it is still a drop in the bucket compared to what is needed to really accelerate the pace of POTS research. And we balance out our research portfolio in terms of what we're funding between mechanistic studies, where we're trying to figure out what is the cause or causes of POTS, and practical kind of clinical care studies, where we're trying to figure out right now, even if we don't know or don't fully understand the causes of POTS, are there treatments we can bring to patients quickly that are better than what we're currently offering? So we kind of you have to take both approaches. And we've seen some progress, I'd say, in the research that we funded. And what we've learned is research takes a really long time. So sometimes something you funded in 2015, it's 2020 and it still hasn't published, but that's because there's always challenges with data analysis or, you know, rechecking that the samples were done properly and just all kinds of stuff. It's been an eye-opening experience to learn that, but we have a great medical advisory board that helps us select the most scientifically rigorous studies that are really going to get the best impact for our grant funding that we give out. We never want to waste money. We never want to, we don't want to fund studies that don't make a difference for patients. You know, there are a lot of things you could get very solid scientific data on, whether or not drinking water helps, but that's not really changing your patient experience because you're already being told to drink a lot of water. So what we want to know is, what's causing this? Does this run in families? Is there anything we can do to get people really, really, truly better? And maybe even prevent it in people that might be at risk. So, so a lot of times people will say to us, how come you only do POTS? And so in the beginning, when we first launched, we had said from the start, we want to be an organization that funds research on all autonomic disorders. But very practically and realistically, you can't be the expert of everything. You kind of have to focus. And, if we try to raise $1 million for 40 different diseases, we probably wouldn't get anywhere. So we focused first on POTS because that is what the majority of our online community has. And those are the people that are donating and getting out there and doing fundraising. But we've always known that there are other patients in our community who have nothing like POTS or something totally different. And it is frustrating, we know, to see more discussion about POTS, which tends to just happen because there's more people that have it. But this year, we're super excited to launch the Dysautonomia Research Fund earlier this summer. And so it's sort of a long list of conditions, but these are the other autonomic disorders that we're going to focus the Dysautonomia Research Fund on. And some of these disorders are overlapping, and some of them actually overlap with POTS too, So we for example, when we put out a call for proposals on this, we received a grant application from Stanford University to study chronic autonomic dysfunction in COVID patients. And some of these patients are presenting with POTS, and some are presenting with orthostatic intolerance. Some are presenting with gastroparesis. So by studying a new disease like COVID, we can actually learn about how all of these autonomic disorders are connected. And so the POTS, even the POTS Research Fund money has benefited other autonomic disorders because most POTS patients have, I wouldn't say most, but a good subset of POTS patients have other autonomic diagnoses or diagnoses of other comorbidities like Ehlers-Danlos syndrome or Sjogren's syndrome. So even when we're focusing our funding on one disease, it still is benefiting people with other autonomic disorders. So this is some of our clinician education activities. I just kind of threw up a bunch of the logos for the medical schools and hospitals and medical professional societies we've done physician education lectures with. We've also done some school nursing education. Surprisingly, or maybe not surprisingly to those of you who know about POTS, a lot of school nurses know about POTS because if you have a high school or a junior high with 1,000 kids, chances are you're going to have a few POTS patients in your school. So this is a great avenue to try to push for some more education, because maybe we can help people get diagnosed faster rather than having to wait until they're in their late 20s to figure out what they actually have. And so we have funded some of these events. We've organized some of these events. We've sent speakers, and you see Dr. Grubb, he's lecturing in this slide, and he's our first speaker later today. And it's really great. A lot of times it's hard to convince clinicians to come to these events because they don't think they need to know about it. They think, oh, these are rare, these autonomic disorders are rare. But if we can get them to show up, they actually love the lectures and they always want more information. And the sign that we are doing a good job is that we very often get asked to come back the next year and do a follow-up. So that's kind of a hint that that the hospitals appreciate this knowledge and they want to learn to do better for these patients. So another thing we do is public awareness. These are some billboards that we've had in cities all over the US. We get the billboard space donated. Electronic billboards are, they often will have a, like a time period where there is no scheduled paid ads. So we'll ask them if they could put up our dysautonomia electronic billboards, and they often say yes. So this is kind of, if you're driving down the highway and you see a dysautonomia sign, it might be us. We also do a lot of media coverage. And part of that is because, you know, we want patients, when you go somewhere and you say, I have a form of dysautonomia, we want people to know what that is. Sort of like if you said, I have autism, or I have Parkinson's, or I have diabetes. We don't want this to be a mystery diagnosis that no one's ever heard of. And we want, because that'll help you get taken seriously, and that'll help you get the compassion that you need from your neighbors and your coworkers and your classmates. So, you know, there are a lot of awareness months for different diseases that everyone's aware of. You know, everyone's aware of breast cancer, right? But dysautonomia truly needs that awareness month because we're lacking in awareness, and even just the name itself is so hard to pronounce. But press coverage has been great because every time we do a news story, the reporter will contact us and say, I've never gotten so many messages after a story in my entire career. So many people with dysautonomia contacted me to thank me for the story. So all of you out there who are contacting the press and saying, thanks for doing the story, that's good, because it kind of helps prime them to do another story in the future. This was a particularly fun event. We've gotten to ring the bell at the stock exchange twice now. This is Jackie Rutter Gully ringing the bell this year. Last year, and I ring it, I think it was a year or two prior to that. And it's probably the most press coverage we ever got. It's this broadcast is shown to about 60 million people around the world every morning. So a lot of business folks reached out to us after seeing that. We also do Dysautonomia Awareness Month lightings, which is a lot of fun to get the monuments in your city lit up. And sometimes it's hard depending on the monument, but some of them, it's pretty easy to get as long as you plan in advance. And then we don't just light it up just for the fun of it. We try to get press coverage based on, we build like an event around the lighting. We try to get some press coverage to help truly raise awareness. And that's the hard part. It's actually pretty hard to get the press to do an awareness story, but we're getting better at it. We've gotten hundreds and hundreds of local newspapers and local TV stations doing stories. This year, it's been very difficult because we're not planning in-person events due to COVID. But there are definitely some, I think there's a lighting happening tomorrow night, which Kirsten can remind me which location it was later. Patient empowerment. So what does that mean? Well, we could have just said patient education, but we wanted to do more than just educate patients, because patients, we as an organization are run by patients and parents of patients. We feel that, you know, patients are their own best advocates. You know, we can have all the doctors and experts in the world, but it's going to be the patients that really move this field forward and help sort of change the world for fellow dysautonomia patients. So we provide educational content in several different forms, you know, printed and events, support group meetings, online, in-person. The in-person ones are canceled for the moment due to COVID. But the most important thing we do is that we give patients advocacy tools and opportunities to give them a platform. There are a lot of people who might want to talk to their friends and family about dysautonomia, but it feels a little awkward, like you don't want to be talking about yourself, or you're not really sure of the timing of when do I bring this up. But if we create an event where we're asking everyone to talk to their friends and family, that kind of gives you like a platform, like a reason that you're supposed to be talking to people about stuff. And I think it's great when we've seen young patients come into our organization as volunteers or maybe guests at our events who are very shy and kind of afraid to talk about their diagnosis and feeling judged. And then like within a year or two, they're like at Capitol Hill, knocking down Senate doors and talking to the media. And it's really awesome to see that transformation of someone. You can't necessarily control every aspect of your disease, but you can control like how you talk about it, and you can control how you can influence how other people will think about it. We've also done quite a bit of direct advocacy, where we have dysautonomia lobby days on Capitol Hill with hundreds of patients and caregivers, and even some of the doctors join us. And we meet with our House and Senate members. My favorite part of this is that it's usually some high school and college students that help us organize like 250 House and Senate meetings in a 4-hour window the day after our annual conference. So that's been some very cool patient empowerment, patients that are so young, just kind of taking over Capitol Hill. We've done the Rally for Medical Research for several years, and that is a disease neutral, meaning every health advocacy organization is involved. And we go and we just push for more NIH funding. And so NIH is the major funding agency in the US for medical research. I know that we have a lot of guests from overseas joining us, and there are probably many countries have a similar agency. And we'd love it if we continue to grow and have a large enough community in other countries to start lobbying, not really lobbying for specific legislation, but advocating for more funding from other government agencies too. Something else we did was we did the first congressional briefing on POTS. At the bottom, you'll see myself and Dr. Glenn Cook and Dr. Jeff Barris. And that was a very well attended event. It was our first briefing ever on the Hill. And we had over 80 House and Senate offices send staff, which is the experienced staffers told us that that's like unheard of for a brand new, young nonprofit that doesn't have a big lobbying team in Capitol Hill. Which we hope to have someday. We managed to get, every year as part of the US federal budget, the government adopts the NIH appropriations bill, which is the funding for the National Institutes of Health, all the research funding. And so NIH doesn't really fund much POTS research. They're funding about, I would say, I'm forgetting the number at the moment, but it's less than $1 million a year. And if a relatively young nonprofit can fund $800,000 a year, surely the NIH that has an over $30 billion budget can find a little bit more money for dysautonomia research. So we put it into we drafted legislation to get into the NIH appropriations bill report, which is this report that goes with the bill to the NIH. And we got the report, we got support from both Republicans and Democrats on the Appropriations Committee to direct the NIH to spend more money on POTS research and to hold a POTS research workshop at the NIH for the first time ever. And this was meant to put POTS on the radar of the NIH. And so we did that last summer, and out of it came a report signed by the NIH that the experts help draft and put together. And we hope that it'll serve as guidance for when NIH is looking at grants to kind of give more support to POTS grants that get submitted to getting funded. And so advocacy is like a long game. There's no quick and easy fix to make anyone in Capitol Hill pay attention to us more. We have to just be really persistent and keep poking, and eventually we'll get what we need to get, but it is a long process. We've also done meetings with high-level staff at the FDA and the CDC to make sure they understand the needs of the dysautonomia patient population, and some state-level advocacy on individual issues related to insurance access and service dogs. So here's how you can get involved. There's a lot of words on this page, but probably the best thing to do would be to get involved with your regional Dysautonomia International support group. Our groups are based on Facebook, but they have in-person meetings and events too. Right now, the in-person stuff is put on hold due to COVID, but hopefully sometime next year we'll be able to start that up again. They have online meetings for people who can't come to the in-person meetings. And of course, during COVID, everyone's been doing the online stuff. We work with volunteers all the time to plan Dysautonomia Awareness Month events, whether that's a proclamation or a lighting or a fundraiser, or even just an education dinner. There's a lot of fun, creative things you can do. And our staff is here to help. We have 5 people on staff, and they help people put together events all over the world. Another thing you do is ask medical professionals in your family or doctors you might have a good relationship with, would they be willing to work with Dysautonomia International to bring a clinician education course to their local hospital or medical school or nursing school. And we've done this all over the US. We've done some in Canada. We're working on our first events in Australia and Sweden, which we're pretty excited about. Let's see, you could also host an information table at like a community health fair, at a school. Again, during COVID, this is a little hard to do because a lot of those things are canceled, but hopefully life will be back to normal eventually, and we'll start being able to do those community-based events. And it's amazing, even we've done events in sort of very rural communities, middle of nowhere, and someone does an info booth, and 20 people come up to the table throughout the day and say, oh, my kid has this, my wife has this, my neighbor has this. So it's really cool to be able to connect people in a community together, because when you work together, you can get a lot more done. And then of course, helping with fundraising. I don't want to ever sound like I'm begging for money, but when we are begging for money, it's so that we can do more advocacy research and more funding for research, So you could get involved with our race teams. Every year we have different dysautonomia and POTS themed events. These are the three more popular ones: the Dysautonomia Dash, the Race to Beat POTS, the POTS Walk. They happen at different times throughout the year. You could always create a Facebook fundraiser for no particular reason. Dysautonomia Awareness Month in October is a great reason to have a fundraiser. And we have a matching grant challenge where we are being offered up to $50,000 in matching grants from Viji Simo, who is our Fireside Chat featured speaker this weekend. And last but not least, you could always donate your birthday or special event occasion type stuff. So with that, I'm going to try to wrap up. Here's our speakers. We have so many great speakers coming up. I know it'll be hard for everyone to tune in for 4 days straight, but definitely pick your favorite sessions to watch and then catch the rest in video at the end. Probably sometime next month, we'll have the videos out. I wanted to thank our sponsors. We would not be able to do this conference for free without the very generous support of all of our sponsors. So a big thank you to them. Check out in your conference program, there are links to all the sponsors, and I want you to check them out whenever you can. And I also just wanted to say, this is, I think, my second to last slide. So because we're not in person, it's kind of feels weird. We're just like all sitting in our living room with yoga pants on, right? So, which is great. but one way we can sort of interact with each other during the conference is with this DysConf 2020 hashtag. So using that on Facebook and Twitter and Instagram, we can sort of share some photos with each other, share your favorite quotes from the conference, share what you've learned. And on Saturday night during the award ceremony, we're asking everyone to do a virtual toast with us. So get a turquoise looking hydrating beverage, and we'll toast the award ceremony winners with this hashtag that time. So I am done with my slides. I wanted to let our Spanish speaking guests know this message in Spanish, which I'm not going to try to pronounce. My Spanish is pretty terrible. But for our English speaking guests, we're offering the next 6 sessions with a Spanish language translator. So if anyone wants to hear the sessions in Spanish, just follow the instructions on this slide. And with that,